Cardiopulmonary resuscitation, also known as CPR, is a procedure performed in an emergency when the heart stops, with the goal of prolonging circulatory and lung function, according to Joseph Cimarella. Why is CPR important? There are so many reasons, facts, and statistics to why CPR is important. Most importantly, CPR saves lives. CPR is a simple two-step process, and anybody can get certified. CPR is important because 100,000 to 200,000 lives of adults and children can be saved each year if CPR is performed early enough. Without CPR, it only takes 5 minutes for the victim to become brain dead. Brain death is caused by lack of oxygen in the body and produced to the organs. CPR circulates blood and oxygen flow, preventing brain death until help arrives. By performing CPR, you circulate blood so that it can provide oxygen into the brain, body, and other organs. You perform CPR when someone is unconscious, unresponsive, and not breathing normally. CPR saves lives. Sudden cardiac arrest is the leading cause of adult death in the country. Nearly 383,000 people out of the hospital is when sudden cardiac arrests occur, which is close to 900 people per day. 88% of sudden cardiac arrests occur at home. This means that CPR is needed frequently. However, only 32% of victims actually receive CPR from a bystander. CPR is a simple two-step process. The first step, call 911. The second step is to push hard and fast in the center of the chest. CPR is generally 30 compressions with 2 breaths. Repeat this over and over until more experienced help arrives. CPR done within 5 minutes of a person's collapse and professional care can increase survival rates as much as 50%. There are certain things that can be done to prevent cardiac arrest. Getting regular checkups and heart screenings, such as electrocardiograms, can be helpful in preventing cardiac arrest. One certain way to prevent cardiac arrest is to live a heart-healthy lifestyle. A heart-healthy lifestyle can be achieved by not smoking and only using alcohol in moderation, no more than 1 to 2 drinks per day. Eating a nutritious, balanced diet and staying physically active is also important in the heart-healthy lifestyle, according to the Mayo Clinic. Risk factors are also very important in finding signs of cardiac arrest early. Family history of coronary artery disease, smoking, high blood pressure, high cholesterol, obesity, diabetes, and a sedentary lifestyle are risk factors of cardiac arrest. Also, too much alcohol, a previous heart attack, and a family history of heart disease can also be risk factors. A heart-healthy lifestyle is definitely the way to prevent cardiac arrest. Men after the age of 45 and women at the age of 55 are more likely to have sudden cardiac arrest than younger adults. Also, men are 2 to 3 times more likely to experience sudden cardiac arrest, according to the American Academy of Pediatrics pre-participating physical evaluation. Some people don't even know what cardiac arrest is. Cardiac arrest is sudden, unexpected loss of heart function, breathing, and consciousness. A few warning signs of cardiac arrest are losing consciousness, stopping normal breathing, losing pulse and blood pressure, and the victim may possibly collapse. A victim's chance of survival drops 7 to 10% after every minute that passes without CPR. After 10 minutes of resuscitation is not likely to work well, according to the American Heart Association. Out of the 300,000 people that suffer cardiac arrest outside of the hospital, 92% of them don't even survive to be discharged. With early defibrillation, survival rates are about 30 to 45%, according to the American Heart Association. Around 400,000 lives could be saved each year if bystander CPR was consistently provided and AEDs were widely provided. Realistically, CPR saves just 1 in 8 hospital patients. Only about 6.4% of cardiac arrest victims survive because witnesses don't know CPR. 7 to 8 million people a year seek treatment for chest pain. Of these, 2 million people will actually have a cardiac condition that affects the coronary arteries. About 1.5 million people will suffer a heart attack. 500,000 of these people will die. Out of those 500,000, 250,000 of these patients will die within the first hour of symptom onset, according to the American Heart Association. It is important to get CPR certified. The American Heart Association trains more than 12 million people in a year. With more CPR certified bystanders, our streets, stores, homes, etc. will be safer.